Mongolia is a country located in Asia with a current population of roughly 3,179,997 people. Mongolia's population pyramid resembles a Hershey kiss, meaning that it's thicker at the bottom and much more pointy at the top. During the state socialist period, education was one of the areas of significant achievement in Mongolia. Illiteracy was virtually eliminated, due mostly to the use of several boarding schools for children of nomadic families. Funding to these boarding schools was cut, however, in the 1990s, contributing to slightly increased illiteracy. Primary and secondary education formerly lasted 10 years, but was expanded to 11 years. Since the 2008 to 2009 school year, new first graders are using the 12-year system. English is being taught in all secondary schools beginning in the 4th grade. The very first Constitution of the People's Republic of Mongolia, ratified in 1924, stated that the population of Mongolia was to be provided with health care services free of charge, which was incredibly decisive and far-sighted at the time. As a result of tremendous efforts taken in preparing national healthcare services, healthcare workers and personnel specialized in Western medicines and set up medical facilities of different levels in rural and centralized areas. By 1940, there were 12 national medical doctors, 159 medical practitioners, 38 health professionals, 269 nurses, and 157 branches of bag-level medical practitioners in rural areas who had undergone special training on pharmaceuticals, as well as 37 hospitals in the cities. In order to ensure extensive coverage, Mongolia introduced a compulsory health insurance system based on the principle of solidarity, which requires both the employee and the employer to pay the same amounts, while the insurance fees for underage children, senior citizens, and other vulnerable groups of societies are paid for by the government. The introduction of this system in 1994 enabled the government to provide health insurance cover to 92.4% of the total population. In 2012, there is a very small difference between the male and female population of Mongolia. There are approximately 295 more females in 2012. In general, Mongolia has deadly cold climates, and therefore, the men who have to work outside are more likely to catch some sort of disease or sickness, which could therefore result in them dying sooner, and that could be the cause of this difference between the males and females. Mongolia would generally be described as a moderately developed country, with a GDP of $4,800 compared to that of the US at $48,300. Mongolia is the 135th wealthiest country in the world. Literacy rates of 97.4% proves that Mongolia is definitely not a developing country, but their economy is not nearly strong enough to be considered a developed country. In the year 2012, in the 100 and plus age group on the population pyramid, there were 3 males and 19 females in Mongolia. In the 1920s and 30s, when the now oldest generation was in their prime, Mongolia was in conflict with many other countries due to the fact that they were in the midst of forming their very first government. Particularly in the early 40s, Mongolia was in war with Japan. It is very possible that during this time, when many men were fighting for their country, they lost their lives in battle, which would decrease the male population, and that could still be the result of this very, very significant difference in the number of males and females in the 100 plus age group of Mongolia. In about 40 years, the baby boomers, who were born about 25 years ago today, will start to reach the age of retirement, which will make the top half of the pyramid a little thicker than it is now, as seen in the photo. It also appears that in 40 years, there will be a decrease in the population and birth rate compared to today, which could result because of a poor economy or some sort of plague. The suffering economy could be due to a tax increase on the rest of the country when the baby boomers begin to retire. To determine the percentage of the population that has yet to reach childbearing age for the year 2012, I took the number of females 14 years and younger, which is 421,838, and divided this number by the total population, 3,179,997. This gave me a percentage of 13.3%. This number is fairly strong, which means that it would make sense for there to be a constant increase in childbirth in the future. However, the population pyramid for the future does not support this statistic. Mongolia is definitely not currently experiencing baby boom. The age group of 20 to 30 years old is by far the largest age group on the population pyramid. In order for a country to be experiencing baby boom, the youngest age group of 0 to 4 years old has to significantly be larger than all other age groups on the pyramid. Therefore, Mongolia definitely is not experiencing a baby boom at this time.